Mark Daly reporting for Paralyzed Veterans of America News online from Summit 2011 in Orlando, Florida. And one of our keynote speakers this week is Dr. Jonathan Perlin, who, of course, many people will be familiar with from his previous government service, and has a new incarnation, or incarnations I should say, and gave a very interesting speech this morning about healthcare reform, something that I think we're all grappling with to fully understand. Dr. Perlin, pleasure to meet you, sir.
Mark, it's great to be with you here this morning, and great to be with PVA today.
Well, I must ask you, being an old VA guy, what does it feel like to be associated with Paralyzed Veterans of America again?
Oh, it's terrific. Of course, I had the great privilege and honor working under Secretary Mansfield, who is an inspiring individual, but also was a thought partner and making some of the changes in VA that frankly occurred about a decade before what's going on in the country today. VA had to create and demonstrate value. It had to adopt electronic health records. And today, the United States is facing great questions and challenges and value. I think there's a lot to learn from the sort of work that PVA and Secretary Mansfield inspired and led.
Well, it's interesting. I suppose inevitably coming from the UK, where we have something called the National Health Service, I always get many questions asked of me, about healthcare reform and about public healthcare. But I think back to Philip Longman's old famous phrase about VA being the best public healthcare in the world. And now, of course, some of those aspects are, as you say, being modeled in the healthcare reforms that have been made law recently. Tell us a little bit, disentangle and demystify some of this for us, because one of the things that's sort of shone out of your presentation this morning to me was that healthcare reform is essentially payment reform in a way, isn't it? Because people tend to think about the healthcare piece of it, but not really one of the key pieces of it, which is how people get paid, how doctors and clinicians get paid in the process, right?
Well, thanks, Mark. Great questions. First, the financial model is changing. It's moving from more is better to better is better. And this is really important because the incentives really create a pull toward coordinating care for patients between their preventive services and their period where they may be in the hospital, maybe in rehab, and this is reinforced by new payment mechanisms like bundling or even accountable care. That degree of accountability is something we know a lot about in VA. We're probably the most scrutinized health organization in the world. But many of the same sorts of metrics in VA, preventive services metrics that were used in the population at large, and things that Dr. Margaret Hammond did in the spinal cord injury program, measures of performance, not measures of volume. It's great to take care of a large number of people. It's more important to take care of a large number of people well. And those are the sorts of measures that are being tracked today in the United States and that are directing resources. It's also an approach to healthcare that's heavily information intensive. Having the electronic health record in VA, having been part of a team that really implemented that, we saw the ability to create the glue that connected veterans in their homes to any of the formal sites of care, and the fuel, the opportunity to understand how we were performing, where we needed to improve, and to really celebrate with veterans the improvements. We have that opportunity in the United States, and the current initiative for meaningful use to get electronic health records out to patients, to connect the silos of healthcare, is, I believe, one that will clearly link together a framework for better outcomes for patients, more humanized, more informed, and ultimately higher value. That means better care, more efficiently delivered.
Well, indeed, and one of the things I'm asking all of our interviewees this week and this weekend is that, of course, we have a time machine here at the Summit, and you and I could probably jump into it right now and go forward 10 years into the future. If we did, he said with tongue-in-cheek, what sort of things do you expect to see happen? Your best hunch as to, if we jumped out in 10 years' time, what will we be looking back at? What sort of breakthroughs, and not necessarily in healthcare reform, but just in terms of spinal cord medicine in general?
So let's take a look at medicine. With all of this information, the opportunity to learn about the new uses of devices, the opportunity to link genomic and molecular information with patient experience to really create the better outcomes is very exciting. Nanotechnologies, molecular biology, new therapeutics that allow reinnervation are things that we're very excited about, that allow muscles to be redeveloped. The opportunity for tissue culture where new tissues can be grown in the lab, in vitro, for implementation. These are things that seem like science fiction, but I believe will be very much real. Not so long ago, it seemed like something that would allow hearing, a cochlear implant, seemed far-fetched. Now cochlear implants, reasonably available. At the cusp of development are optic implants that actually artificial retina that actually transmits light signals into the brain. The interface between informatics and human body to really allow optimization of function is very exciting. Now, let's step back and say, what about healthcare more broadly? Why can I do things so easily in terms of getting a book downloaded to a Kindle on Amazon, but to get an appointment I have to go through a thrash of phone calls and paper? I think we'll be able to manage our health information in a much more effective and informed way. That there'll be information that's available to me. Ultimately, it is my health information. It'll be tied to knowledge. Here are some things you're at risk for. Here are some things you need to address. It will be coordinated. There'll be an individual, maybe not necessarily a doctor, maybe a nurse practitioner, maybe someone else, who will work with me to coordinate. I will have preventive services organized in a way that's really optimized to the unique genetics of me personally, that's time sensitive, make sure I don't miss my annual opportunity for a flu vaccine, for example. Number one vaccine preventable cause of death is flu. But that when things happen, the right people know about it. The people I want to know about those events know about it. For instance, if I'm in an accident in the hospital, my records come together, and then care is coordinated following that. The economic incentives for that are really what are implied by accountability. The tools for carrying that out include information, electronic health records, and so I think 10 years from now, we can look back in the same way that that we look back at things that seem commonplace now, and say, I can't believe we weren't doing that in 2011.
Isn't it always that way? Hindsight is a wonderful thing, especially if you've got a time machine, right? Dr. Jonathan Perlin, thank you so much for your leadership. And I didn't do a shout out to your new incarnations, which the viewers may be interested in. What are you doing now? Give us your official titles and the organizations and businesses you're involved with.
Thanks, Mark. I'm pleased to be a part of national-based HCA. HCA is a large healthcare provider, nation's largest private healthcare provider. We were really proud yesterday that Joint Commission identified 405 top performers in the country, and 77 of those were HCA hospitals on the basis of accountable performance measures. So you can probably tell that my passion is for high performance, and I think accountability is fair. And it's something that we owe patients, we owe all. And so working on clinical performance improvement, not surprisingly, electronic health records, bringing up 160 hospitals on electronic health records across that HCA system. So very much building on the set of skills that were part of what we did in VA. And to all my VA colleagues, would really give you all a shout out for the magic that you create each and every day and caring for the veterans that we're so privileged to serve. Mark, thanks so much for the opportunity to be with you.
Jonathan, thank you, and good luck in all your ventures.
Thank you, and thanks to PVA for putting this great event together.
Our pleasure, thank you.